Are you tired of feeling embarrassed about your size and performance in the bedroom? Have you noticed that what used to be rock hard and impressive has become smaller, softer, and less reliable? What if I told you there's a simple 3-minute daily technique that could not only restore your hardness, but actually make you appear larger and more powerful than you've been in decades? My name is Dr. James Whitaker, and I've been helping men reclaim their masculine confidence for over 30 years. Today, I'm going to reveal a shocking discovery that the pharmaceutical industry has been desperately trying to hide from you. A natural technique so powerful that it's helped thousands of men add visible inches to their size while dramatically improving their hardness and performance. But before I share this life-changing information, I need to tell you something that might shock you. Last month, a 58-year-old patient named Robert walked into my office looking defeated and ashamed. "Dr. Whitaker," he said quietly, "I'm losing my wife." She tries to be supportive, but I can see the disappointment in her eyes. "I've gotten smaller, weaker, and I don't know what to do about it. I feel like half the man I used to be." What Robert told me next broke my heart. He pulled out a grocery bag filled with enhancement pills, pumps, and devices he'd spent over $3,400 on in the past year, all promising to restore his size and confidence. "Nothing works, Doc. I'm starting to think I'm beyond help." That's when I taught Robert about the hidden muscle system that controls your size and hardness. Muscles that 99% of men don't even know exist. In just 6 weeks, using nothing but a 3-minute daily routine, Robert experienced changes that shocked both him and his wife. His size increased visibly, his hardness returned to levels he hadn't experienced in 20 years, and his confidence was completely restored. His wife actually called my office to ask what kind of miracle treatment I'd given him. "Doctor," she said, "I don't know what you did, but my husband is like a different man. He's bigger, harder, and more confident than he was when we were newlyweds." What's your secret? Before I reveal this technique that's changing men's lives, I want you to hit that subscribe button right now. The information I'm about to share has helped thousands of men add inches to their size and transform their bedroom confidence. And I don't want you to miss any of these powerful strategies. Now let me ask you a direct question, and I want you to answer honestly in the comments below. Have you ever avoided intimacy with your partner because you were embarrassed about your size or performance? If the answer is yes, type YES in the comments. If you've never felt this way, type NO. Your honesty will help other men realize they're not alone in this struggle. The secret lies in your pelvic floor muscles, specifically two muscles called the bulba cavernosus and isocavernosus. These aren't names most men have heard, but they're literally the difference between looking and feeling small versus appearing larger and more powerful than ever before. Here's what's happening to you right now that's making you appear smaller and less impressive. As men age, these crucial muscles weaken and lose coordination. The bulbar cavernosus muscle is supposed to contract powerfully to trap blood in your penis, creating maximum hardness and size. The isocavernosus adds additional pressure and helps maintain that impressive upward angle that makes you look bigger and more dominant. When these muscles are weak, which happens to virtually every man over 45, blood escapes too easily. The result is erections that not only feel softer, but actually look smaller and shorter than they should be. You haven't actually shrunk, but your muscles can no longer create the internal pressure needed to achieve your full potential size. Let me ask you another question that I want you to think about carefully. When you look at yourself now compared to 10 years ago, do you feel like you've lost some of your masculine power and confidence? Drop a fire emoji in the comments if you've ever felt this way. I need to know how many of you are dealing with this silent struggle. But here's the incredible part. When you strengthen these muscles correctly, something amazing happens. You don't just get harder, you actually appear larger. The increased pressure fills your erectile chambers more completely, creating visible increases in both length and girth that shock men who thought their best days were behind them. Let me tell you about a groundbreaking study that proves exactly how powerful this technique is. Dr. Gray conducted a randomized controlled trial following men dealing with size and performance issues. After just 6 months of pelvic floor muscle training, over 40% of participants regained normal function, and another 35% reported noticeable improvements in their firmness, control, and yes, their apparent size. That's more than 75% of men seeing measurable benefits using nothing but targeted muscle training. These men didn't change their medications or undergo expensive procedures. They simply learned how to activate muscles that had been weakening for years. Here's a question that might be uncomfortable but needs to be asked. Have you ever measured yourself and been disappointed by what you saw? If you've experienced this, write "been there" in the comments. If you've never worried about your size, write "no concerns." I need to understand what percentage of my viewers are dealing with these confidence issues. The hidden truth about perceived size. Here's something that will blow your mind. When I say this technique can make you appear larger, I'm not talking about magic or impossible promises. I'm talking about unlocking your body's natural potential that's been suppressed by weak muscles. Technically speaking, pelvic floor exercises don't increase the anatomical length of your penis. That's not what these muscles do, but they dramatically increase the pressure and fullness of blood within your erectile chambers, and that creates visible changes in how your erection looks and feels. Think about it like this. Imagine a balloon that's only half inflated versus one that's completely full. The balloon is the same size, but the fully inflated one appears much larger and more impressive. That's exactly what happens when you strengthen your pelvic floor muscles. You're finally achieving your full potential instead of settling for a weak, partially filled version of yourself. Many men describe seeing increases in both length and girth, better upward angle, more fullness at the base, and dramatically improved hardness. Robert told me after 6 weeks, "Doc, I measured myself and I'm actually bigger than I was in my 20s. My wife can't believe the difference." Now, I want to ask you something that will help me understand your motivation. What would it mean to you personally if you could feel confident about your size and performance again? Would it improve your relationship, boost your self-esteem, help you feel more masculine? Share your thoughts in the comments. Your answer might inspire another man who's struggling with the same issues. But there's also a neurological component that makes this even more powerful. When these muscles are activated correctly, your brain experiences improved sensory feedback. You don't just look bigger physically, you feel more aware, more connected, and more confident. Many men describe having better control, better rhythm, and significantly more pleasure during intimacy. The 3-minute daily protocol that changes everything. Now let me teach you the exact technique that's transformed thousands of men's lives. The good news is that this requires no equipment, no gym membership, and no expensive treatments. But it does require consistency and proper technique. Before I explain the technique, I need to know something about your current situation. How often do you currently exercise or focus on your physical health? Are you someone who works out regularly, occasionally, or hardly ever? Type regular if you exercise consistently, sometimes if you're inconsistent, or rarely if you don't exercise much. This will help me understand how this routine will fit into your lifestyle. The first step is learning to identify the correct muscles. The easiest way to locate them is during urination. Try gently stopping the flow midstream. The muscles you use to do that, without clenching your thighs or holding your breath, are part of your pelvic floor. That's not a training technique, just a one-time test to find the right area. Once you've identified these muscles, you can begin the real training. Find a comfortable position, either sitting or lying down. Take a few normal breaths, then gently contract those same pelvic muscles as if you're trying to lift something internally. You shouldn't feel tightness in your abdomen, legs, or chest. If you do, ease off and refocus on isolating only the pelvic muscles. Here's the exact protocol that's worked for thousands of men. Week 1 to 2. Foundation building. Contract the muscles gently for 3 seconds. Release completely for 5 seconds. Repeat 10 times. Do this 3 times per day, morning, afternoon, evening. Week 3 to 4. Strength building. Increase contractions to 5 seconds. Maintain 5-second releases. Increase to 15 repetitions. Continue 3 times per day. Let me pause here and ask you a crucial question. Are you the type of person who starts exercise routines but struggles to stick with them? Or are you someone who commits fully once you decide to do something? Type starter if you often start but don't finish. finisher if you always complete what you start, or depends if it varies. Understanding your personality will help me give you better advice for success. Week 5 to 8, power development. Work up to 10-second contractions, 10-second releases, 20 repetitions, 3 times per day. Week 9 to 12, mastery level. 10-second maximum contractions. Focus on both strength and control. 25 repetitions, 3 times per day. The key is thinking like an athlete. You're not trying to push harder every day. You're training for control and coordination, not just raw power. The early results are often subtle: improved awareness, easier muscle activation, better stamina during intimacy. These small improvements build the foundation for the dramatic changes that come later. Here's another important question I need you to consider. What time of day do you think would work best for you to do these exercises? Are you more motivated in the morning, during your lunch break, or in the evening? Type morning if you're a morning person, midday if lunch works better, or evening if nights are your preferred time. Planning your timing increases your chances of success dramatically. What you can expect timeline. Here's exactly what most men experience as they follow this protocol. Weeks 1 to 2. You'll start feeling more connected to these muscles, even if contractions are still weak. Many men report better awareness during intimacy. Weeks 3 to 4. Improved muscle endurance and confidence, with less effort required to engage the muscles. Some men notice slight improvements in firmness. Weeks 5 to 6. Better control during intimacy, improved stability, and the beginning of visible size improvements as blood flow increases. Weeks 7 to 8. Noticeable improvements in firmness, angle, and for many men, visible increases in apparent size, especially if weak blood flow was limiting you before. Weeks 9 to 12. Dramatic improvements in size appearance, rock-hard firmness, and complete confidence restoration. This is when men typically see the most shocking results. Now let me ask you something that will help set realistic expectations. Which of these timeline phases are you most excited about reaching? Are you hoping for quick improvements in weeks 1 to 2? Or are you willing to wait for the dramatic changes in weeks 9 to 12? Type quick results if you want fast changes, or long-term if you're willing to be patient for maximum benefits. Your mindset will determine your success. Remember Robert, the 58-year-old who felt like he was losing his wife. After following this exact protocol, he called me in amazement. "Dr. Whitaker, I can't believe what's happened. I'm not just bigger and harder, I feel like a completely different man. My confidence is through the roof, and my wife, well, let's just say she's very happy with the changes." The science behind the transformation. What's really happening when you strengthen these muscles is something called veno-occlusive function. When your bulbocavernosus and isocavernosus muscles are strong, they create a powerful compression system that traps blood in your erectile chambers. This creates the internal pressure needed for maximum size and hardness. But strength alone isn't the complete picture. What many men over 50 need is neuromuscular control, your brain's ability to quickly recruit the right muscles at the right time. This is where the gradual progression I outlined becomes crucial. You're not just building muscle, you're rebuilding the nerve pathways that control these muscles. Let me ask you a question about your current confidence level. On a scale of 1 to 10, how confident do you feel about your performance in intimate situations right now? Type a number from 1, not confident at all, to 10, completely confident. This baseline will help you track your improvement over the coming weeks. Many men also benefit from biofeedback techniques that provide real-time information about muscle activation. This can include guided apps or simple awareness techniques that help you learn exactly when and how to contract these muscles for maximum effect. There's another benefit worth mentioning that most men don't expect. These same muscles support bladder control, prostate stability, and overall pelvic health. So even if size and performance aren't your main concerns, keeping these muscles strong helps you stay ahead of common age-related challenges. Why your doctor won't tell you this. You might wonder why this information isn't more widely known. The answer is both simple and frustrating. First, most physicians receive virtually no training in pelvic floor rehabilitation during medical school. We're taught to prescribe medications and perform procedures, not recommend natural muscle training that patients can do at home. Second, there's no profit in teaching men exercises they can do for free. Pharmaceutical companies make billions selling pills that temporarily mask symptoms, while this technique actually addresses the root cause of the problem. Here's a question that might reveal something important about your healthcare experience. Has your doctor ever discussed natural approaches to improving your performance, or have they only offered prescription medications? Type natural discussed if your doctor has mentioned natural options, or only pills if they've only suggested medications. Your answer will help other viewers understand what to expect from their healthcare providers. Third, many men feel embarrassed discussing these issues, so doctors often default to quick pharmaceutical solutions rather than explaining natural approaches that require patience and consistency. The truth is, pelvic floor muscle training is completely safe when done correctly, doesn't interact with medications, and for many men offers a greater sense of control than depending on pills that may lose effectiveness over time. Advanced techniques for maximum results. Once you've mastered the basic protocol, there are advanced techniques that can accelerate your results even further. These include breath coordination, coordinating your breathing with muscle contractions to maximize blood flow and muscle activation. Progressive overload, gradually increasing not just the duration of contractions, but the intensity and complexity of the exercises. Functional training, incorporating these muscle contractions into real-world situations to improve automatic responses during intimacy. Combination protocols, adding complementary exercises that support overall pelvic health and circulation. Many men find that combining this muscle training with other natural approaches, like specific foods that boost blood flow, targeted stretches that improve pelvic circulation, and lifestyle changes that support hormone production, creates even more dramatic results. Here's a question about your willingness to make broader changes. Are you someone who prefers to focus on one thing at a time? Or are you willing to make multiple lifestyle changes simultaneously for faster results? Type 1 change. If you prefer focusing on just the exercises, or multiple changes, if you're open to a comprehensive approach. This will help me understand how to best guide your transformation. The complete life transformation. What's remarkable about this technique is how it affects every aspect of a man's life. When you feel confident about your size and performance, that confidence radiates into your work, your relationships, and your overall sense of masculine identity. I've seen men who were considering divorce reunite with their wives. I've watched guys who were avoiding intimacy completely become more passionate than they'd been in decades. I've witnessed transformations that go far beyond just physical changes. These men reclaim their entire sense of masculinity. Now let me ask you the most important question of all. What would your life look like if you never had to worry about your size or performance again? How would it change your relationship with your partner? How would it affect your confidence at work, in social situations, or just in how you see yourself in the mirror? Take a moment to really think about this, then share your vision in the comments below. Your answer might inspire another man to take action. The choice is yours. You can continue feeling embarrassed, avoiding intimacy, and hoping that expensive pills will somehow restore what you've lost. Or you can take control of your body's natural systems and unlock the size, hardness, and confidence that's been waiting inside you all along. This isn't about turning back the clock. It's about becoming better than you ever were. Many men tell me they're more impressive in their 60s than they were in their 30s because they finally understand how their body really works. Before I finish, make sure you've hit that subscribe button and notification bell. I regularly share advanced techniques and cutting-edge discoveries that can help you maintain and improve your masculine vitality well into your golden years. Your transformation starts with a simple choice. The choice to believe that your best days aren't behind you, they're just beginning. This 3-minute daily routine could be the key to unlocking confidence, size, and performance you never thought possible. Here's my final challenge for you. In the comments below, I want you to answer 3 questions. 1. What's your biggest concern about your current size or performance? 2. Which week of the 12-week protocol are you most excited to reach? 3. What would successfully completing this program mean for your life and relationships? And if you're truly committed to following through with this complete 12-week transformation, write reclaim. So I know you're serious about changing your life. Your size, your hardness, and your masculine confidence are waiting to be unleashed. The only question is, are you ready to claim what's rightfully yours?